To this in-person and online audience event. Welcome to the global launch of the World Health Organization technical brief, this rather splendid document that I hold in my hands here. It's a very important document covering both infectious and autoimmune causes of encephalitis, or encephalitis for some of you that are joining us online. And it's set, in my opinion, to change the landscape of encephalitis in both the global north and the global south, so applicable to countries and continents across the world. We are few in number in person due to it being the school holidays here in the UK, and also due to the globally distributed nature, of course, of our audience. But we do have an online audience of nearly 300 people from 48 countries represented this evening. So welcome to all of you. I'm Ava Easton, and I'm the chair of Encephalitis International. And not the chair. My chair is sat here. It's because my boss is sat in the front row, and it makes me slightly nervous. So I'm not the chair. I'm the chief executive. But what I am going to be the chair of is the launch this evening. And I'm going to ask, first of all, each of our panellists to just introduce themselves and the institution that they're representing. And Tom, I'm going to start with you, please.
Hi, everyone. My name's Tom Solomon. I am Professor of Neurology at the University of Liverpool, and I'm representing the University of Liverpool. I'm also the Director of the Pandemic Institute, who are very interested in this area. And I'm the Academic Vice President at the Royal College of Physicians, who've also grown increasingly interested in this area over the years. More to follow.
Thanks very much. I'm Ben Michael, also Professor of Neurology and Director of the Brain Infection and Inflammation Group, also at the University of Liverpool. And for the purposes of tonight, I'm Chair of the Scientific Advisory Panel for Encephalitis International.
I'm Aline. I am a neurologist and a neuroimmunologist in Brazil at the University of São Paulo, and I had the pleasure to receive an international seed funding from Encephalitis International in 2019.
Good evening. My name is Nicoline Schiess. I'm a technical officer at the WHO headquarters in Geneva, Switzerland.
Thank you, everybody. So this evening, Professor Solomon will provide a reminder for all of us of the science of encephalitis and some of the top global challenges. Dr. Schiess, as she said, joins us from the WHO and is going to give us a good overview of the technical brief, its intentions and some next steps. Professor Michael will follow with perspectives on the impact of the technical brief for global change. And finally, before questions, we will hear from Dr. Matos, who will particularly focus on the impact of the brief for low to middle income countries and challenges for its implementation in such settings. For those of us here in person, we will conclude with some networking drinks and nibbles, canapes, so do please stay on with us after we close. And the event will close at 8 p.m. this evening. Before I hand over to each of my colleagues in turn, it's my pleasure to outline a little of the background that led up to today and the launch of this World Health Organization technical brief. In February 2020, just as we were entering the COVID-19 pandemic, Professor Solomon and I delivered a short report on why encephalitis matters, along with a petition signed by people from 128 countries to the World Health Organization in Geneva. At this time, we were also working behind the scenes on a global report, which was very much a kind of full analysis of encephalitis around the world and what some of the gaps were. This looked at being a summary document, really, of everything that we knew about all the varying aspects of encephalitis, along with identification of what we considered some of the critical gaps. As the pandemic continued, our report finally came to a conclusion in 2021, after which we approached the head of the Brain Health Unit, Dr. Tarun Dua. At this point, I would like to add my formal thanks to her, as she has been a critical friend and key supporter in helping us reach where we are today. Dr. Dua at that point said, well, send me the document, we'll have a look at it. And she came back and said, this looks like important work and we would like to host a global stakeholder meeting over 2 days where we can get a better understanding of global perspectives around the world. We were so pleased at achieving our goal of securing a listening ear at the World Health Organization. And that meeting by the WHO was held in June 2022. From that meeting emerged another extremely important document which summarised the findings of the meeting, and this was launched to coincide with World Encephalitis Day 2023 and was called simply Why Encephalitis Matters. In the interim, myself and the other co-authors of the global report published from it in peer-reviewed journal, an article which was well received. So fast forward to September 2023, and Encephalitis International and the WHO made an agreement to develop this technical brief with input from stakeholders around the world. At this point, we would like to recognise all of the many, many people who have contributed to this important document that brings us here, and indeed one of them with us this evening, Irina Tamborska, who was important in the writing of this document. And so it is today, again, being launched to coincide with World Encephalitis Day later this week on the 22nd of February, a day that since its inception has now reached 628 million people around the world, that we launched this seminal document, a technical brief by the WHO, which outlines encephalitis, global threats, trends, and public health implications. The document makes clear that the condition is a growing public health threat with an urgent public health imperative, that it represents a significant yet under-recognised global health challenge with substantial mortality or death rates and substantial disability burden, along with not insignificant economic impacts. We've known for some time that the true global burden of encephalitis is currently unknown, particularly in low to middle income countries, and the report recognises the heavy costs associated with neurological sequelae and the impact upon those affected and their families, often the greatest burden of which can be found in low to middle income countries. So I'm going to pause at this point and hand over to Professor Solomon to remind us of the science of encephalitis and some of the top global challenges. Tom.
I reckon if I clap for you, then when I'm done, everyone will clap for me. Hope so. Great. So I'm Tom Solomon. I think I didn't say that I'm president of Encephalitis International, but I will be told off for that when people are reviewing the video later. At least I didn't say I'm chief executive or chairman. So it's great. It's kind of these events are always a bit strange because in some ways it's a formal event, launch of the technical brief. But in other ways, it's just like being back with family and friends. And so it's good to see people, especially in person. And I'm hoping people will stay for a drink afterwards and some delicious canapes beyond the little snacks and crisps that you've seen. So worth sticking around for. And we have people online. Hello, everyone online. It's not this you're not the onliners. No. Are they up there? Which is the online camera? Is there one? It is, yeah. So we have to say a special, I'll look straight down the lens. We have to say a special hello to them because I looked through the list of people, recognised a few names, but there's many people there who I think this may be their first engagement with Encephalitis International. And so we are inviting you now, the clinicians, to our annual conference, which is in December. Happens every year, beginning of December, and it's a great get-together. So if you've not done that before, then please join us for that. I have been, and that's at the Royal College of Physicians, which is, I said I'd mention that. And it's become a bit of a sort of home for us in a way when we have our annual meeting. So the science of encephalitis, I've spent about 35 years studying that, but I have to decide what to tell you in just a few minutes. So if this is your first encounter with encephalitis and you hadn't really heard of it before this event, put your hand up now yeah, it's all right. Good, because you're the target for the next few minutes, because some of them they know all about it. And online, just put hands up online. Let me see. Looks like about a third. Okay. So encephalitis means inflammation and swelling of the brain, and it's basically, and by inflammation, if you scratch your hand and it goes red and angry, that's what inflammation means. And if that happens on your hand, it's just a bit uncomfortable. But if it happens in your brain, and your brain is in a fixed box called the skull, then that causes problems. And that's why encephalitis is a particular problem. So this inflammation and swelling can be caused by infections, especially by viruses, or by the body's immune defences, and that's called autoimmune encephalitis. And in terms of which viruses can cause encephalitis, pretty well every virus can do, but some are more important than others. And I'll give one example of the three important types, because those are ones we've worked on. So herpes simplex virus is the virus that causes cold sores. And sometimes, instead of causing a cold sore, it goes up into the brain and causes, if you like, a cold sore on the brain, swelling and inflammation. That's the most important and common sporadic cause of encephalitis. So happens, unfortunately, anytime, anywhere, in anybody. Japanese encephalitis virus is the most important mosquito-borne cause of encephalitis, and that occurs across all of Asia and is spreading. So in the last couple of years, it's got to Australia and been causing problems there. And then the third virus to think about is the COVID virus, which also is an important cause of encephalitis and other brain problems. So basically, these viruses get into the brain, cause swelling, but sometimes, for reasons we don't completely understand, even though there's no virus there, the brain, the body's host defences, thinks there's a problem, and it sends antibodies and it sends white blood cells to attack the brain, thinking there's an infection there. That's autoimmune encephalitis. So I could tell you more about the science. I won't. I think there's Q&A at the end, so if people have questions. But, I mean, there's always loads of questions, like why does it happen in some people and not others? Why do different pathogens cause different types of encephalitis, etc.? So we can come back to those questions, because I'm going to stick to my time limit of 10 minutes, because I always do. So let's move on and talk about the global challenges. Well, one of the biggest global challenges is about recognition of the disease. And we just heard about World Encephalitis Day. It's happened every year since 2000 and something. What was it, 2014? Yeah, that was and we did the world's biggest brain in Liverpool, created it with people. So it was the world's biggest organ, image of an organ made of people. And there's a nice video of that online if you want to have a look at it. But I didn't realise that we'd connected with 628 million people since then. Yeah, somebody spent a lot of time counting. Anyway, I don't know how you count these things, but we certainly have connected with a lot of people. And the reason we know this is because when this organisation started as the Encephalitis Support Group back in 1998, only about 2 in 1,000 people had heard of encephalitis. And the Encephalitis Support Group became the Encephalitis Society in, anyone? Some years subsequently. And most recently, it became Encephalitis International about 2 years ago. And now we know that about 2 in 10 people have heard of encephalitis. So it's much better than it was, 2 in 1,000 to 2 in 10. But it's still not enough. So raising awareness is a really important part. And once awareness is raised, then you can increase surveillance. And so surveillance means basically knowing how much is out there. And organisations like the WHO and public health authorities do lots of surveillance. So the next problem, you need doctors and nurses and healthcare workers to think, well, this person who's coming to hospital with a few days' history of a fever and maybe a headache, the worst headache they've ever had, and maybe they're behaving a bit unusually. You need the medics to think, oh, this could be encephalitis. And that's why recognition is so important. And once they think of it, then they have to improve the diagnosis. And we've done quite a lot of work to understand why the medical community is sometimes slow to diagnose encephalitis and how we can speed that up. And we have made some progress in that over the years. So we've done work in the UK, and it used to take about 48 hours between somebody arriving in hospital and the diagnosis being made and them getting on the right treatment. And with our work over the last 10 years or so, we've got that down, but we still need to improve it further. It's down to an average of about 12 hours, if you're interested, to get on acyclovir. At one point in the Northwest, we had it down to about 6 hours. So that's diagnosis. Treatment we've talked about as well, getting people on treatment. I'm giving a bit of a UK focus, but actually with the diagnostic piece, we should also think about the work we've done globally through a program called Brain Infections Global, which was done in partnership with Encephalitis International. And we've shown how with some very simple measures, you can improve the rate of diagnosis and the speed of diagnosis in India, Africa, we chose Malawi, and Latin America, we chose Brazil. And these are the kind of things that have gone into this technical briefing to then provide local policymakers with the tools to implement them. But I'm wandering off-piste because others will talk about that. So let me get back to the brief. The final, there are other important pieces, but one other really important piece is in terms of challenges is rehabilitation, getting people rehabilitated. So that's kind of broad brush, but let's talk a little bit specifically. What are the current challenges globally in encephalitis? So some of the causes of encephalitis are spreading. I talked about Japanese encephalitis virus spreading. Others are spreading. There's a virus called tick-borne encephalitis virus, which was in Europe and has arrived in the UK recently. And one of the reasons some of these bugs are spreading is because of climate change. So that's a challenge. Climate change is a challenge for all sorts of reasons, and all health organisations that I know about are doing their bit to reduce the impact in terms of carbon of their work to get towards net zero. You may even find tonight everything we eat will be vegetarian, I think. I had a quick look at the menu for the nibbles. That's part of the drive towards net zero, because eating beef is bad in terms of CO2, eating vegetables is good, to keep it simple. So one of the other big challenges, and with 1 minute to go, I'll finish on this, is, and we saw a lot of this in the pandemic, is science misinformation. There's vaccine hesitancy, which means that vaccines are being used less now than they were before the pandemic. And that's absolutely nuts. So if you said to somebody 5 years ago, there's going to be a pandemic, it's going to kill millions of people around the world, the thing that's going to get us out of the pandemic is vaccines, and then you said to them 5 years ago, what do you think that will do to vaccine rates overall? You'd say, well, they would all go up, of course. But the opposite's happened. So vaccine hesitancy is an issue for us, and it's part of this bigger picture of science skepticism and false information. So it's up to us as a community to push out the right messages and make sure we do it in very simple ways. That's part of what tonight's event's about. I'm going to stop. I've got 5 seconds left. What's my final message? Enjoy this evening. Get involved. You people here are all involved. The people online, my friends out there, do they get the chance to send messages and questions? They do. Well, send messages, questions, comments. You can even now have a go. Type in, tell us where you're from and whether you've heard of encephalitis before, and then we can get that information at the end of the evening. And at this stage, I'll hand back to the chair, who is not the chair of Encephalitis International, but she's the chair of this evening. Ava Easton. Thanks, Ava.
Thank you, Tom. And now we're going to hear from Dr Nicoline Schiess from the World Health Organization.
Thank you, Ava. So it is a tremendous, tremendous pleasure to be here this evening. As I mentioned previously, my name is Nicoline Schiess. I'm a technical officer and a neurologist in the Brain Health Unit at WHO headquarters in Geneva, Switzerland. The Brain Health Unit was established in 2020 in recognition of the increasing burden of neurological disorders on a global scale. So neurological disorders are the #1 cause of disability worldwide and a very high cause of mortality as well. And so I want to start out first with a big thank you to Ava and to everybody involved in Encephalitis International for the support in producing this technical brief. I also want to first acknowledge 2 other consultants who I worked with very closely and who none of this would have been possible without their hard work. So one is Irina Tamborska, who is sitting here. Irina spent countless hours scoping out the global situation of encephalitis. She drafted the first draft. She consolidated all of the comments that all of our stakeholders submitted on that first draft. The second consultant is not, unfortunately, with us today, but I believe he is online, Johanni Godama. Johanni was phenomenal and spent hours putting together the maps in the brief, as well as proofreading and taking care of any last-minute, the house is burning down kind of requests that I sent his way in a panic. So a very big thank you to both of you. Also, I'd like to say a warm thank you to the people with lived experience who were a part of this brief, who shared their personal stories with us and added depth and meaning to our work. So I was asked to tell you a little bit about what a WHO technical brief is. So a WHO technical brief is a document designed to provide technical information and recommendations on a public health issue. Most often, the technical briefs are targeted toward low resource and low and middle income countries, and they are often applicable on a global scale. So as part of our brain health unit and the Neurology Action Plan, or the Intersectoral Global Action Plan on Epilepsy and Other Neurological Disorders, which we affectionately call the IGAP. As part of the IGAP, the mandate was to create technical products which people can use in order to improve the care and services for people with neurological disorders. We've produced two prior to this, one on epilepsy and one on Parkinson's disease, and this is the third one in our series of technical briefs. In addition to the IGAP, the brief is also aligned with other WHO initiatives, such as the Defeating Meningitis by 2030 Global Roadmap, the Arbovirus Initiative, as well as the incredible work that WHO is doing on multiple pathogens such as rabies, measles, mumps, rubella, polio, Japanese encephalitis, and many other pathogens which can cause encephalitis. So it's very much a cross-cutting technical brief across all departments within WHO. The target audience for the brief includes policymakers, public health professionals, health program managers, healthcare providers, and researchers, all of whom are involved in improving the diagnosis, treatment, and care of encephalitis. The brief follows the structure of the strategic objectives of IGAP, covering diagnosis, treatment, and care, such as care pathways, social protection and welfare, rehabilitation, and the importance of an interdisciplinary workforce, as well as UHC and primary care. It then addresses surveillance and prevention, particularly vaccines and vector control, followed by research, advocacy, and awareness. The brief outlines key actions to be done in each of these areas, including public awareness and education, which are crucial interventions for partners such as Encephalitis International and people with lived experience. Moving forward, where do we go from here? From the WHO Secretariat side, our first priority is to disseminate this brief as much as we can, and part of that is coming here in person to help promote it. In addition, we would like to have other WHO departments and other WHO initiatives at global and regional levels will be involved in the dissemination of the brief. Relevant departments in ministries of health will be notified of the technical brief through WHO regional and country offices, as well as through NGOs who are in official relations with WHO and WHO collaborating centers. We hope, furthermore, to conduct capacity-building activities for encephalitis and other brain infections through web-based platforms and regional workshops. So this is a very exciting time for neurological disorders in general, and in particular for brain infections such as encephalitis. There's a lot of work going on, and this technical brief was a large part of that effort to improve the lives of people who have encephalitis, as well as their families, caregivers, and communities. So once again, a big thank you to everybody involved with this effort, and we really look forward to continuing the work together. Thank you, Ava.
Thank you, Nicoline. And now we're going to hear from Professor Benedict Michael, who's going to talk to us about his perspective on some of the impact of the technical brief for global change.
Great, thanks very much. I'm going to talk for less than 5 minutes, but I think it goes without saying, really, that the impact of this WHO technical brief globally is potentially huge. when you think about it, in terms of disability-adjusted life years, the neurological morbidity from encephalitis is the third leading cause in children globally, and it's the 14th leading cause for all ages. So it's no wonder that it's rightly got its place after epilepsy and Parkinson's disease, being right up there as the third technical brief being produced as part of the IGAP. There's huge potential for this technical brief to have genuine global impact that's transformative in the brain health agenda. I think the first thing it can do, and let's be honest, I care passionately about encephalitis, but it is fair to say we've lagged behind many other neurological conditions like stroke and epilepsy and Parkinson's. But this WHO technical brief really puts encephalitis on the map. And that's really important because that whole care pathway that's going to improve patient outcomes starts with awareness. Part of it building on and leveraging this WHO technical brief, but also building on the great success, as you've heard, of World Encephalitis Day. What this also does is it sets out a really clear platform that can drive the clinical research agenda in the months and years ahead, helping to build on some of the collaborations and coalitions that were forged during the heat of the pandemic, like the Global Neuro Research Coalition that I co-chair. Over 170 clinical academics from 78 different countries engaging with thousands of clinical researchers around the world every single month. This is how we build real global change, and the priorities that we need to address are set out clearly in black and white in this technical brief. The sorts of research and interventions that can arise from this, including improved public health policy, whether that's due to rolling out and improving the efficacy of vaccine programs, whether it's vector control, or whether it's increased awareness, whether that's at a community level or at a clinical level in hospitals. Our hope is that by advancing diagnostics, we'll have a better understanding of disease burden, which is critical for surveillance and critical to inform the health economic implications of public health policy. And then for us as doctors on the ground, we really hope that the priorities laid out in this technical brief will feed into consensus clinical guidance, patient care pathways, and targeted diagnostic algorithms, which help us better understand the disease burden and better how to treat these patients. And beyond that, by understanding the disease burden and the economic and health implications of them, we can inform policymakers about what diagnostics, what treatments, what rehabilitation needs to be available in their area. And it's only really through this improved access to better healthcare, better medications, and better rehabilitation that we're ultimately going to reach our ultimate aim, which is to improve the outcome of our patients with encephalitis. And this technical brief is a major step in that direction. Thanks.
Thank you, Ben. I would, at this point, encourage those of you that are online to please start putting some of your questions, some of your comments into the chat for my team to pick up so that we can reflect that here in the room at the Wellcome Trust in London. Those of you here in person, hopefully you'll have some questions for our esteemed panel. And before we take your questions, we're going to hear from Aline Matos, and she's going to talk a little bit about the impact of the technical brief for low to middle income countries and challenges to implementation.
Good evening, everyone. It is an honor to be here today to talk a little bit about encephalitis in low and middle income countries. A condition that remains under-recognized, under-treated, and under-diagnosed in many regions where it has a devastating impact. The launch of a WHO technical brief is not just an academic exercise. It is a call to action. Today, we focus on encephalitis, but we could name many previous technical briefs that have transformed global health, from primary care to chronic diseases. In my country, Brazil, several goals of these briefs are pursued every day in our public health system. And if I may say, encephalitis is just one example of why working together matters. As we learned from COVID-19, diseases do not respect borders, politics, or ideologies. They affect us all. Technical briefs drive change by prioritizing neglected and emerging diseases, by mobilizing international funding, by standardizing guidelines and strengthening health systems. From what we've heard, we do not know the full number of encephalitis cases worldwide, but we do know that infectious causes play a major role. And in low and middle income countries, many of these pathogens are either emerging or being neglected. I cite here just one example. Virus is increasing in cases in South America right now and is yet barely studied. Without surveillance, these infections will continue to spread almost unnoticed. Encephalitis today is not a funding priority in many low and middle income countries, not because it is less important, but because these countries face multiple crises. Lack of clean water, limited access to education, overburdening healthcare systems, is cause of armed conflicts. And in reality, it is difficult to choose what to prioritize. But encephalitis must be a priority. It has a high prevalence in children. It causes severe disability in adults. It leads to long-term social and economic burdens that are even harder for us, citizens of low and middle-income countries. A technical brief can make a difference. It brings visibility and encourages investments. And what's missing in most hospitals? MRI and EEG are unavailable in most rural areas. Many hospitals do not have lumbar puncture kits for CSF tests. Most cases are handled by general practitioners, not neurology specialists. A WHO technical brief provides clear guidelines to train health professionals, improve diagnostic and treatment pathways, ensure access to essential medicine. And what needs to be done? We need sentinel surveillance sites to detect outbreaks early. We need affordable and rapid diagnostic tools for different areas. We need expanded vaccination programs for Japanese encephalitis, for dengue, for chikungunya, for measles. We cannot afford to wait for the next pandemic to act. This technical brief is a roadmap for change, but a document alone will not save lives. That depends on us, healthcare professionals, researchers, policymakers. Let's prioritize encephalitis in low and middle income countries. Let's push our authorities for better funding and diagnostics. Let's strengthen global surveillance and response. Health should not be a privilege. Health is a right. And the time to act is not tomorrow, it is today. And I hope to keep working on this topic with all of you. Thank you.
Thank you for that, Aline. I've got a feeling we may be using that rousing speech for some time to come in some of our materials. So now it's the time where we're going to take some questions. I understand from my team that we have some online questions, but whilst one of my team come down and tells me what they are in a moment, let's open up the floor. Are there any questions in the floor? Katie? Yeah, we'll just get you a mic, it's okay. Yeah.
Hi, good evening. Thank you very much. My background's in tropical medicine, so I deal with vaccinations for TB and Japanese encephalitis, but I was amazed to learn today that the HSV herpes vaccine causes encephalitis. I just wondered if you'd tell us a bit more about that and maybe some numbers of people that experience encephalitis through the herpes virus and whether it's herpes 1 and 2 that can cause encephalitis. Thank you.
Thanks very much. Shall I take them? So both the herpes viruses can cause brain infections. Herpes virus 2 tends to cause a meningitis, although it can cause an encephalitis, and HSV1 tends to cause an encephalitis. And we think I mean, these viruses have been with us since the Egyptians, and the way they've evaded the immune system is by hiding within inside nerves, of course, and it's that retrograde axonal transport along nerves that allows them to hide, and we think that's why HSV1 causes encephalitis particularly. In terms of how many people, it's by far and away the most common sporadic cause of encephalitis. It's probably in the region of 20% of cases of encephalitis, possibly higher if you just group those with a known etiology in the immunocompetent population. We've known since the 1980s that the drug acyclovir, which is a thymidine kinase dependent analog that blocks the replication of the virus, takes mortality from 80 to 90% down to 10 to 20%. So we have an effective drug that we've known for decades works, and it's the most common cause of sporadic viral encephalitis, which is one of the reasons why it's one of the many priorities in this brief.
Thank you. Are there any more questions from the floor here? Angela, Professor Vincent.
I was just curious about when Tom said that Japanese encephalitis seems to have got into Australia. At what stage does one start talking about vaccination in that sort of situation of a new invasion?
Tom.
Thanks. Yeah, good question. So the virus occasionally had got to the Australian Torres Straits Islands about 20 or 30 years ago, single cases, and then was found to be, you look at the mosquitoes and find a few viruses. But in the last couple of years, it's got established in JE, in Australia. Nothing like the numbers of cases that we see across Asia, and mostly the humans that were affected. So the virus is transmitted among birds by mosquitoes, and then it spills over into pigs, and then it spills over into humans. So there were lots of cases in pigs, and the humans that got affected were mostly adults working in pig farmeries or living nearby. So the human cases have dropped partly because they're now using better screening around the pig farms to keep the mosquitoes in. And also people have tried vaccination of pigs in the past, but you wouldn't, at the moment, the risk-benefit ratio and just the cost of vaccination of humans means it's not a sensible approach. But if cases increased dramatically, then people would start considering that. And we've had the same in America with West Nile virus. So again, mostly sporadic, human cases have been sporadic. And although people have been working on vaccines, there's not really, the health economic argument wouldn't really support it yet.
Thanks, Tom. Hadi.
Great, thanks. I just wondered whether industry has been involved in the production of this technical brief when it comes to diagnostics and costs of medicines worldwide.
Dr. Schiess.
So they weren't directly involved. However, their input is certainly valuable, and as you know, diagnostics is a large gap for encephalitis. So you know, they are partners as well, but they were not actively involved within this particular brief.
Okay, let's take some questions from. Oh no, we have to. The chair of Encephalitis International has a question. So online, I'm coming to you next. Gagan Gahir.
The actual chair.
The real chair.
The real chair. So this is, I guess this is to all of you really, but we often talk about the challenges that we as a collective and individuals have to deal with in regards to encephalitis awareness and successful treatment of it. It can all be a bit depressing, can't it? So this amazing report aside, on the flip side, what are the most encouraging trends or strides forward that you have each experienced?
Wow, okay. Let's start with Aline, perhaps.
Well, I think that having a technical brief gives us a document to fight for patients and to make policymakers aware of their suffering. In a technical brief, we can read some text from patients telling exactly the struggle you are telling us about. So it is important to have a document from an institution that is so respected everywhere. I guess this is the greatest contribution.
For me, I'll chip in, and then I'm going to come to Ben, and then Nicoline, and then Tom. For me, I think this is going to be, we've talked about the document being a lever for change, but I also think for those who are online and in the room who work in the areas of research, I think having this document is going to have huge leverage, because although organisations like Encephalitis International have been saying these things are important for a long time, it's the first time that the World Health Organization has said it. And so I think that this is a huge lever in making our case for why there should be more funds for this condition. Ben?
Yeah, thank you. I think as a clinical academic, you have to be perennially the optimist to survive in this career. But I do genuinely think there's a whole host of reasons to be cheerful. Let's look back at the success of some of the vaccine campaigns for other viruses. Look at polio eradication. Look at some of the great work that's been done in rabies. And despite the challenges with the geographical spread of Japanese encephalitis virus, vaccine programs have made a real difference on the ground. So I think vaccines are a huge part of it. And whilst there's so much to discuss, if I had to pick out one other thing, I think that we are potentially on the verge of a technological leap in close-to-patient diagnostics, which cut out a lot of the expensive lab side of diagnostics, which has held us back for so long. So lots of reasons to be cheerful, but vaccine and close-to-patient diagnostics are my top two.
Nicoline, and then Tom, and then we're going to go to the people online.
So for me, personally, it's been tremendously gratifying when you consider that over 100 pathogens can cause encephalitis, plus the exploding field of autoimmune encephalitis. To be able to bring all of those under one umbrella into one document so that we can present this to ministries of health and to member states to really implement policy change in prevention, in vaccination, in vector control, in diagnosis, treatment, and care, raising awareness, for me to be able to pull it into one document to hand over to people and say, let's get to work and let's start policy change has been very gratifying.
Tom?
Yeah, thanks. So the only thing I would emphasise that's not already been emphasised is treatments. In the past, it's been really difficult to develop treatments, and we effectively had just one treatment, which is acyclovir. But because of the work of Encephalitis International, bringing clinicians together and raising awareness, we've been able to do over the last 10 years a study of whether dexamethasone, it's a steroid drug, would be helpful. And we've finished that study just over a year ago and written it up, due to be has to be accepted by the journals first. But the messages coming from the work suggest that that might be a helpful treatment as well. And then we think about the autoimmune encephalitis where we have treatments. So I think it's worth emphasizing treatments. But the whole thing, the whole advantage of the tool is it brings everything together and it acts as a, I kind of suggested what you really need to do is roll it up and go and meet policymakers and emphasize that everything is in here that we need to do, and it's laid out how we can do it, and now we're getting the teams together to do it. So that's why it's really a seismic change, I think.
Thank you to the panel. So who from my team, okay, so one of my team is going to be calling out some of the questions from our online audience. Alina.
The first question, could you elaborate on the climate change encephalitis connection?
Yep, Tom. Yep.
Yeah. So climate change is driving encephalitis through a range of means. The most obvious is mosquito-transmitted viruses are spreading because mosquitoes are spreading, reaching new territories. So, for example, in Nepal, where we've worked for some time, the only places you got Japanese encephalitis was in the lowlands where the rice paddy fields were. And as you went into the foothills of the Himalayas, it was too cool to support the mosquitoes. No mosquitoes, no bites, no virus, no disease. But over the last 10 years or so, the virus has crept into those areas because it's 1 to 2 degrees warmer. So I think the mosquito-borne causes are the most obvious ones, but other impacts, flooding impacts, again, on mosquito growth. If you have flooding, you have wastewater that supports mosquitoes. So again, an increased mosquito burden. Hygiene also is impacted by climate change and civil disruption. So a whole range of causes. Others can add if they want, yeah.
I think that what Professor Tom is saying, it's happening right now in Brazil. Some colleagues asked me if here was too cold here in London today, and I was telling that we are having heating waves never experienced before in Brazil. And right now, even in our richest city, which is São Paulo, we are having floods every week. This was never happened before. And because of that, we are expecting a new epidemic of dengue in the state, even bigger than the one we had last year.
Okay, next question, please.
In the priorities outlined for improving patient care pathways for infectious acute encephalitis, this call to action will include collaborating with groups working towards any of the priorities, and if yes, how would we be able to connect?
So we had a meeting earlier today with some of the core group that have been working on this technical brief and with the World Health Organization. And in my closing few words, I will be asking anybody who wants to collaborate. There will be various collaborations going on. We've outlined what some of those are. We need to write that up. We need to now talk to some of our peers and global stakeholders and get their views on what we write up. But we will certainly be looking for collaborations from trusts and foundation funders through to industry, whether that be diagnostics or pharmaceuticals. So I think if people are interested in collaboration, then please get in touch with us after this. Tom.
Thanks. I think in addition to that, the question was around patient care pathways and how our work overlaps with other priorities. And I think it does. So, for example, as Ava said, a lot of our discussion this afternoon was about how this encephalitis document integrates with the WHO's other related work on meningitis, and there is overlap, for example, in patient care pathways of those, and to some extent it's about coordinating those and bringing them together. Nicoline might want to say a bit more on that.
Absolutely, and actually also all brain infections and neurological disorders, if you think about rehabilitation and brain injury. So brain injury, regardless of the cause, causes the same sequelae and the same troubles after discharge from hospital. And so if we can combine and work together for the sequelae of encephalitis, then obviously the rewards will be much greater.
For those that are interested, I mean, this is part of in a way, a much larger piece of work that sits under the World Health Organization intersectoral global action plan on epilepsy and other neurological disorders. And so that might be a document that people want to have a look at, also known as the IGAP for short. Alina?
Which are the key steps that WHO can do to support the clinical implementation of the brief's guidance across countries with their diverse healthcare systems?
Nicoline.
Yeah, so WHO follows the mandate from member states. And so when member states ask, as they did, they unanimously voted for the IGAP. And the IGAP covers everything from prevention, promotion, tackling stigma and discrimination in diagnosis, treatment, and care. And so when we are asked by member states to produce an action plan in order to tackle these neurological disorders, that is where our mandate is. And so we directly interact with ministries of health in order to try and change policies and try and get national plans so that we can address all of those factors.
Alina?
How can we, as a community of non-medics, help with the brief?
That's a good question. Well, we've got an appeal out at the moment for some pilot funding to start putting some things. So if people can do fundraisers and make donations towards the work, that's certainly one area. But I think as we go forward, driving forward some of the strategy from this, I think there will be an opportunity for people in the wider community to comment on some of those things and provide their views. Certainly at Encephalitis International, we have a range of kind of stakeholder groups that we call upon for various different things, whether it be getting involved in research or volunteering, commenting on things like our information. So we tend to have a range of stakeholder groups. At the moment, we're developing a global training platform, and we have a global stakeholder group for that, and we will be looking to beneficiaries of this condition to contribute. So I think there'll be lots of ways going forward. And Ben?
Yeah, thank you. And if that person asking or others listening are either directly or indirectly affected by encephalitis, we are particularly interested in those with lived experience of the condition. There's some fantastic work being led by Daniel Munbet on core outcome sets for encephalitis, and other work on patient-reported outcome measures. And we really have to have these standardized measures agreed globally with input from those with lived experience so that we can do better trials, so we can better understand the disease burden, and so that we can actually do the studies that are going to really change practice.
Yeah, and you will see in those of you, so some of the people online may have looked at the technical brief, but again, it's very much got some examples of lived experience in there from people they consulted as part of bringing this publication together.
A question for Tom. You mentioned vaccine hesitancy. What simple message should we be sending out to reassure people who have been bombarded by false information about vaccines?
No, I mean it. I mean, it's dead simple. It's dead simple. We have this all the time. There are some people who you will never convince. They have fixed views. Don't waste your time talking to them. Just be polite. You know, we have this in clinic, for example, seeing patients and then talking about vaccinations. So some people have fixed views and you won't be able to change their mind. And so don't waste your time or their time and just be polite and agree to disagree. But they're a small group. I think a bigger group are those who are hesitant because of things they've heard. And usually what it boils down to is people ask you, well, would you take the vaccine or would you get your child vaccinated? And I think if you're a trusted voice and you answer that question honestly and the answer is yes, it's straightforward. But I would point out that it's very different. Many of this audience would happily hear that from me because we're mostly professionals from similar backgrounds. But if you're a very different person living in a different environment in a different part of the country, I am not a trusted voice for you. I'm just blah, blah, blah on the telly on BBC Breakfast in the morning. And the trusted voices for you are voices in your community. They might be religious leaders or other leaders. So our work in terms of reaching that wider audience is to you're kind of wasting your time if you try and talk directly to people, but it's to convince their leaders and their trusted voices and let them spread the message. And it's kind of interesting area, but I think don't shy away from it, but also don't waste too much time with people who have fixed views.
Thank you, Tom. And I think I just would add to that we do not have treatment for many causes of encephalitis. And so, but we do have vaccines that prevent encephalitis, and Encephalitis International, we strongly believe that our gold standard has to be preventing this disease rather than treating it when it happens, if we can do so at all. And one of the ways that we can stop people dying is through vaccination. Really quickly.
Just one other important thing to add. Vaccine rates also relate to how easy it is. So for years, I was hit or miss whether I got around to having my flu vaccine in the hospital because it was a pain to go to the occupational health. Once they started coming around with the little trolley, following the sweet trolley, it was dead easy. And, because they made it easy. And the same applies with some of our vaccine figures. We expect people to get to vaccine centres when they may not even have a car or the money to get the bus. But if you take vaccination to the people, it's easier.
Okay. Thanks, Tom. So we're coming towards the end of this now. Is there any more burning question, Alina, from online? Otherwise, I'm going to come back to this room, take one more question here, and then I'm going to close.
Another question is, how will the brief help people impacted personally or their families directly?
It's another good question. Well, one of the things I hear all the time from people that have been impacted and their families is their desire to help other people and to stop this happening to other people. So I think that that's one way. There's certainly a section in the brief on the importance of rehabilitation, which is often very different in the global south to what it is in the global north. So there's a lot of work around that, and we spent a chunk of time this afternoon talking about what that might look like. So I think it will have an impact. I'm not sure it will impact people that have been affected and their families immediately and recently, but I think it will have an impact going forward. Nicoline, did you want to add anything to that?
I agree, absolutely. And rehabilitation services are almost non-existent in many places in the world. And so even to try and get basic rehabilitation services available for people who need them makes a big difference to a person's life.
Thank you. Is that everything, Alina? I'm sure that it sounds like there's lots of questions online, but...
We have a couple more, but not sure
Okay,
if we have
well,
time.
we're running out of time. Are there any more questions from in the room? Yes, Arena.
Thank you. I know we are closing, so I just wanted to offer a sort of final reflection because we touched upon so many topics today. We talked about prevention, vaccination, controlling the mosquitoes. We spoke about early recognition, acute care, access to hospitals, diagnostics, treatments which are quite complex for encephalitis, and then also about the rehabilitation. So I think really what it shows is that this is a challenging condition to address, but by contributing to action on encephalitis, we are helping to strengthen the health systems, not just for this condition, but also for all conditions that affect patients with neurological disorders, and also those affected by diseases from other body systems in general. So I think that was a big challenge of the brief, but perhaps one of the strengths is that it can affect not just sort of simple one condition, but it can have impacts on so many other diseases.
Thank you, Arena. And on that note, I will bring us to a close. I would just like to say if there's any media in the room or online, Kathy Bartley is our Global Health Communications professional for this launch this evening. And one of my team, if they haven't already, will be putting her email into the chat online. And if you're media in the room, then you can talk to her yourself. She's here for our drinks reception. So I just want to finish up by saying this launch is an extremely important moment for encephalitis and everybody that it impacts around the world, along with those such as the clinicians, the scientists, the researchers and so on, who endeavour to minimise its impact. And we've heard a lot about some of that this evening. We are incredibly grateful to Dr. Tarun Dua and to Dr. Nicoline Schiess from the World Health Organization, both of whom have been encephalitis champions and who've been pivotal in making today become a reality. Our thanks to our panellists this evening and to all the global stakeholders who contributed to the technical brief, some of whom Nicoline mentioned earlier at the WHO. There was a lot of people around the world that contributed to this document. We now call upon those of you in a position to collaborate and support actions of the briefing and indeed fund the identified needs in this document to work with us to reduce the devastating mortality, morbidity and associated impacts of this condition. I invite anybody to contact me directly to initiate or to continue any discussions. Thank you all for attending today, whether that was in person or virtually. Please stay in touch with our work in order to drive forward the important findings of this brief. I would urge you all to go online to worldencephalitisday.org and watch our small pilot appeal video to ignite some of the funding that we'd like to kickstart our encephalitis action planning from this brief. And also, finally, don't forget, we're all here today because it is World Encephalitis Day on Saturday. So get involved with the day. You can find out all you need to know again on worldencephalitisday.org. So to those in person, please now join us for a drink and networking. Thank you and good evening, everybody. Thank you.